Dear students, welcome back. Now we will see the developmental aspects of structure and function. So, what are the skeletal changes, muscular changes, and articular changes occur during development? Now we are going to see the skeletal changes. Okay, the shape or configuration, the distensibility or compliance, and mobility of the chest wall changes significantly from infancy to the old age. From infancy to the old age. Okay, so that means the shape of the thorax is going to change from infant to old age, as well as the compliance or distensibility అంటే సాగడం అన్నమాట. సో దాట్ మీన్స్ ద ఎక్స్పాన్షన్ అండ్ అగైన్ రికాయిలింగ్ టు ఇట్స్ ఒరిజినల్ పొజిషన్. సో దాట్ ఈస్ ద డిస్టెన్సిబిలిటీ అండ్ ద మొబిలిటీ ఆఫ్ ద చెస్ట్ వాల్. అండ్ ద మొబిలిటీ ఆఫ్ ద చెస్ట్ వాల్ changes significantly from infant to old age. So, the normal newborn has an extremely compliant chest wall. So, the newborn chest wall is very compliant. It is having more distensibility because all these joints in the thorax are primarily cartilaginous joints, and the cartilaginous ribs allow the distortion necessary for the infant's thorax to travel through the birth canal. So such kind of compliant chest helps the baby to come out through the birth canal. So if it is rigid, it is not possible to come out through the birth canal. So it is going to change its distensibility. So that means it is going to change according to the size of the birth canal, because these joints are made up of primarily cartilaginous joints. So actually the shape of the rib cage is almost circular in the during in the infant stage. Okay, in the adult it is different. It is almost some kidney shaped. Okay, it is almost some kidney shaped structure we can see in the adult. Now, so such kind of distensibility is exhibited during the infant stage. Okay, and complete ossification of the ribs does not occur for at least several months after birth. So it will not going to ossify as early as possible, because it will take several months after birth to ossify. Okay, so with such compliant rib cage, the infant chest wall muscles or primarily acts as stabilizers. Normally the chest wall muscles helps in the ventilation, but in infant these muscles helps acts as a stabilizers, because you can see the diaphragm. Okay, here the diaphragm, you can see it is almost flattened. It is not that much dome shape when compared to the adult. This is the adult diaphragm. It is very much domed, well domed, but in the infant it is not domed. Why? Because here the ribs are arranged. In adults the ribs are arranged obliquely, whereas in the infant the ribs are arranged horizontally. So the ribs are arranged horizontally. What will happen? So this diaphragm already it is in less domed position. It pulls the lower rib cage inward. It pulls the lower rib cage inward. That means the inspiratory capacity is going to be decreased if it is dragged inside. So to prevent this action, the chest wall muscles acts as stabilizers to counteract the action of the diaphragm in the infants. Okay, and also if the ventilatory need is increased, if the ventilatory need is increased in the infant, the accessory muscles are also not well positioned to complete the need for ventilation. So because these muscles are also not that much what you call it as those muscles also not have power to stabilize, to contract over the rib cage, which helps in the expansion of the rib cage, because the baby has to stabilize his or her upper extremities, head and neck. After that only those muscles helps in ventilation. Before that those muscles also not help in ventilation. So the chest wall muscles acts as stabilizers than the mobilizers, because it has to counteract the action of diaphragm. Okay, next one, with aging, so this is about the skeletal changes occur in newborn, and also when the baby will get this obliquity, means when baby starts sitting and standing, the gravity assists the thoracic cage and increases the obliquity of the ribs. Okay, next, with aging, other skeletal changes occurs. With aging, other skeletal changes occur that may affect pulmonary function and ventilation. So, what are the age related changes? So, the costal cartilages ossify. So, we know that the costal cartilages here, for each every joint costochondral and costosternal, in between them these costal cartilages are present. So these are very much elastic in nature. So these costal cartilages ossify. So if these costal cartilages are ossify, that means during elevation of the ribs, so here this costal cartilage is going to rotate, so that axial rotation is affected. So if the axial rotation is affected, then what happened? So we will lose that bucket handle movement as well as the pump handle movement. So that thing will happen if the costal cartilages are going to ossify. And also over the age of 75 years, 70% of people have osteoporosis of the ribs as well as the thoracic vertebrae, which increases the kyphosis of the thorax. So increased anterior concavity, so protruded position. So head will be present like this, and this thorax uh, is like this. So anterior concavity is increased. That means posterior convexity increased at the thoracic region. So the old people, the position, the posture of the old people, you can visualize. So that increased kyphosis is often observed in older people. So what happens if increased kyphosis occurs? And because of increased kyphosis, there is an decreased abdominal tone. So abdominal muscle tone is reduced because of this increased kyphosis, and the kinematics of ventilation is also affected because the resting position of the diaphragm would be less domed in the kyphosis. So the shape of the diaphragm, the dome of the diaphragm, is also maintained by the tension which is created in the abdominal muscles, which increases the intra-abdominal pressure, which acts as a stabilizer. Okay, and also during expiration it has to recoil its original position. So if there is a decreased abdominal tone, what will happen? So decreased abdominal tone, the intra-abdominal pressure is not that much created, and elastic recoiling of that muscles is also not taking place. So the pressure is not well maintained here, and also other changes in the lungs also taking place because of that age. Due to the age changes, the lung tissue also lost its recoiling capacity, so which increases the uh, lung volume in the inspiratory position, so in the increased kyphosis, so the diaphragm is reduced the dome of the diaphragm is reduced, and the lungs are in the inspiratory position. That means the lungs are in hyperinflated position. Okay, so the chest wall, rib cage, and diaphragm and abdomen compliance all will be reduced with aging. So reduction in the diaphragm and abdomen compliance is probably indirectly linked to the decreased rib cage compliance, because the lower ribs, which are part of zone of opposition, decreases the abdominal distensibility. So such kind of features observed during aging. So what are the features we have observed during aging? So skeletal changes occur in the older age, affects the pulmonary function and ventilation. The costal cartilages ossify, which interferes the axial rotation, and most of the 70% of the people over 75 years have osteoporosis of the ribs and the thoracic vertebrae. And when there is a decreased abdominal tone, the kinematics of ventilation is disturbed because the resting position of the diaphragm would be less domed. Chest wall, rib cage, and diaphragm abdomen compliance are significantly reduced with aging. And reduction in diaphragm and abdomen compliance is indirectly linked to the decreased rib cage compliance. Okay, and also decrease in abdominal distensibility with aging. These are the age changes occurs in the developmental aspects of structure and function. And what are the articular changes we can see in the old age people is many of the articulation of the chest wall will undergo fibrosis. So we know different kinds of joints, that is costochondral, costosternal, interchondral, manubriosternal, and giphisternal joints, isn't it? All these joints will fuse will fuse as a result of aging, because these joints, most of the joints are true synovial joints, but as a result of aging all these joints are going to fuse because of fibrosis. Okay, the synovial joints show morphological changes associated with aging, which causes wear and tear, resulting in reduced mobility. So a very important thing to keep in mind is that decreased mobility in the ribs may contribute to decrease mobility of the thoracic vertebrae, because these are in closed kinematic chain. These are the articular changes occurs during the development. So many of the articulation of the chest wall undergoes fibrosis and fuse in old age. Okay, in this, the joints of the anterior chest wall, particularly the costochondral, costosternal, interchondral, manubriosternal, and giphisternal joints are involved. The other chest wall articulations are true synovial joints, and they are less likely to fuse as a result of aging, but these joints will have some morphological changes associated with aging, that is wear and tear, results in reduced mobility. Okay, so it is important to keep in mind is that decreased mobility in the ribs may contribute to decrease the mobility in the thoracic vertebrae. So these are the articular changes which are taking place during aging. So coming to the muscular changes, so in the muscular changes, the newborns will have approximately 20% slow oxidative muscle fibers in their diaphragm compared to the 50% in adults. So such difference in the adults and the newborns have been seen, which predisposes the infants earlier to get diaphragmatic fatigue. Okay, so aging appears to have little effect on the function of respiratory muscles if when malnutrition and diseases are not present. Okay, so these are the muscular changes seen in the newborns. This is about the general changes like skeletal changes, articular changes, and muscular changes occurs during development. Okay, in the next session we are going to see the changes in normal structure and function. Thank you.